Dr. Crouch again. I'm going to talk to you briefly about a pericardiocentesis. I'll give you a quick demo of what it's like to use the model, and then we'll go through the individual steps within the PowerPoint in a subsequent video. So I have multiple models that are currently available on our website and ones that are in our resident room. The ones that have no spout on them or spout inside are best to fill with ultrasound gel. These will give you a nice view of what it's like to ultrasound and do a quick echo, and you can watch the needle going in. The top of each one will have a rib and 2 areas to access, and then from there you'll have silicone that you can pour on and use as a substitute skin. The ones that have spouts on top are meant to be filled with water so you can aspirate as you go in and get a feel of doing a pericardiocentesis. There are multiple techniques for doing pericardiocentesis. The one that we always talk about in textbooks and talk about doing is going to be the subxiphoid approach. We don't have an easy model for that. These models are actually meant for peristernal approach. Peristernal approach is you simply put the probe on the chest, right adjacent to the sternum, look for the largest pocket of fluid, and go straight in. When you're doing this, there are pericardiocentesis kits that have very large needles, which will have a kind of a tube that you can place in with a single motion. You go in, you feel it, because they're often done blunt, slide the tube in. In an emergent setting, you often don't have those. You have to run, get them from the cath lab, from cardiology. So I try and teach how to use a triple lumen or a paracentesis kits, which with safety needles can also be used. So if we come on over here, I'll go ahead and show you what with our model, just a simple view. So the model, you'll have a rib that's basically not able to see anything over, and after you fill it with water, there will be a visible heart structure on the inside, right through here. You can actually still see some of the fluid, some air bubbles moving around in it, but the heart will be right there. And you feel as if you're doing a peristernal approach and go, look, and look. We do have one model that beats when you pull a string, but I'm just going to show you one of the static models. When you're doing a pericardiocentesis and you're looking for tamponade, you'll go in and look for the largest pocket. If you're seeing the bowing of the ventricle down with signs of a tamponade physiology and one is indicated, from here you can take either, like I said, you can use a central line kit, or you can use a paracentesis tray, or preferably if you have on a pericardiocentesis tray, you'll take your probe, place it on, looking at the heart. You'll track in line. So we're backwards, that's okay. You'll track in line with the probe to watch your needle enter. As you can see, it's entering from the top of the screen. Enter in, aspirating as you go. Once you get fluid, which you would in the setting for pericardiocentesis, you can flip over and just do the modified Seldinger technique just as you would with a central line. In the setting of a where you're using a paracentesis tray, you would just place the safety needle in and feed your catheter directly over. Our devices here are designed so that they can be cannulated, and you can set up and do a line as if you're doing it on a real person. And very quickly and efficiently feed a line over after relieving the initial part of the pericardial effusion, hopefully without causing any additional damage or injury to the heart. And the caveat I'd say is when you're doing a triple lumen line, they tend to be a little on the flimsy side. So although the silicone makes it look easy, like bam, I got it in right away, if you're going through the intercostal muscles or in the front, it will sometimes be hard. The advantage is it's easy to sew down, they're very soft, they're unlikely to injure the heart, and then you have ports that you can aspirate or flush through. All right, I'll go through the techniques and other images individually, But that's the basic idea. These prints and the ones that I have available are just basically hearts that are printed within a box with a lid over it and a rib. And you can either take a silicone sheet and place it over to simulate skin, or if you want to have liquid silicone, you just pour it right on the lid and it creates a little top, something to practice with. Additionally, you can use it to practice doing certain approaches for echo. Okay.